In the tranquil and modern facilities of Horizon Rehabilitation Center, a sense of hope and determination filled the air. The center was known for its innovative approaches to physical therapy and rehabilitation, attracting patients from all over the region. In a private therapy room, Dr. Sarah Williams, a renowned physical therapist, was meeting with James Parker, a patient recovering from a severe sports injury. Their session was focused on developing a tailored plan that would guide James through the challenging journey of regaining his strength and mobility.
James, I've reviewed your medical history and the progress you've made so far. While you've come a long way since the injury, there's still a lot of work ahead. What are your main concerns as we move forward with your rehabilitation?
I've been worried about how long it will take to get back to where I was before the injury. I know it's a slow process, but I'm anxious to get back on my feet. From your experience, what's the most important factor in making sure I recover fully?
The key is consistency. Recovery isn't just about intense effort. It's about steady, consistent work that gradually rebuilds your strength and flexibility. Question: James, what do you think is the most important factor in ensuring a full recovery from a serious injury? A. Maintaining a consistent therapy routine. B. Pushing your limits to regain strength quickly. C. Staying mentally positive throughout the process.
Answer A. Maintaining a consistent therapy routine.
James, I believe that consistency, option A, is the most critical aspect. Pushing too hard too soon can lead to setbacks, but a steady, disciplined approach will build a strong foundation for your recovery.
That makes sense, Sarah. I guess it's easy to get impatient, but I can see how sticking to the plan without overdoing it is the best way forward.
Exactly. Think of it as a marathon, not a sprint. Each small gain adds up to significant progress over time.
As they discussed the importance of consistency in his rehabilitation plan, Sarah and James worked together to set realistic goals for each stage of his recovery. They focused on developing a routine that balanced effort with the need for rest and recovery, ensuring that James would avoid re-injury while making steady progress.
Sarah, I've also been thinking about the mental side of this. It's tough staying motivated when progress is slow. How do you think I should approach the psychological aspects of recovery? Question: Sarah, what's the best way to stay mentally strong during a long and challenging recovery process? A. Setting small, achievable milestones to stay motivated. B. Regularly visualizing your full recovery to maintain focus. C. Seeking support from friends and family to keep your spirits up.
Answer A. Setting small, achievable milestones to stay motivated. James, I think setting small, achievable milestones, option A, is the best approach. Celebrating these little victories helps keep you motivated and gives you tangible proof that you're making progress, even if it feels slow at times.
I like that idea. It's easy to get discouraged when you're not seeing big improvements, but focusing on the small wins could really help keep me going.
Exactly. By breaking the journey into manageable steps, you'll find it easier to stay positive and focused on the end goal.
They talked about how to set these milestones, with Sarah suggesting specific targets for flexibility, strength, and endurance. By tracking these smaller goals, James would have a clearer sense of his progress and a better way to stay motivated throughout his recovery.
James, there's one more thing I want to discuss: your daily routine outside of our sessions. What you do between our appointments is just as important as what we do here. How do you plan to integrate the exercises and practices into your everyday life? Question: James, what's the most effective way to incorporate your therapy exercises into your daily routine? A. Scheduling specific times each day dedicated to your exercises. B. Integrating exercises into daily activities like walking or stretching. C. Creating a visual reminder or checklist to keep track of your progress.
Answer: B. Integrating exercises into daily activities, like walking or stretching.
I think integrating exercises into your daily activities, option B, is key, James. It makes the therapy less of a chore and more a part of your everyday life, helping you stay consistent without feeling overwhelmed.
That's a great idea, Sarah. I've noticed that when I try to fit exercises into things I'm already doing, it doesn't feel as daunting.
Exactly. Plus, it helps reinforce the movements and habits that are crucial for your recovery.
They brainstormed ways James could incorporate his therapy exercises into his regular routine, such as stretching while watching TV or doing strength exercises during breaks at work. Sarah emphasized that making these exercises a natural part of his day would increase his chances of a successful recovery.
Sarah, after all we've talked about, I'm wondering, what's the most important mindset I should adopt as I go through this process?
The most important mindset is resilience. Recovery can be frustrating and slow, but if you stay resilient, willing to push through the tough days and setbacks, you'll come out stronger on the other side.
That's good advice. It's easy to get discouraged, but I'll keep reminding myself to stay strong and keep going.
As their session came to a close, both Sarah and James felt confident that they had a solid plan in place. By focusing on consistency, mental resilience, and integrating therapy into daily life, James was well on his way to a full recovery. As James left the rehabilitation center, he felt a renewed sense of purpose, ready to tackle the challenges ahead with the support and guidance from Sarah, knowing that every step brought him closer to regaining his full strength and returning to the activities he loved. Here are 5 key concepts related to the theme of rehabilitation therapy.
Consistency, sticking to a regular therapy routine to ensure steady progress. Mental resilience, setting small goals to stay motivated and keeping a positive mindset throughout the recovery process.
Integration, incorporating therapy exercises into daily activities to maintain consistency without feeling overwhelmed. Support, drawing strength from personal victories and the encouragement of friends and family.
Resilience, maintaining a determined mindset to push through setbacks and continue progressing toward full recovery.